Okay, so we're going to discuss about the history of the Japanese culture. So Japan overall is about 1,200 miles of a chain of islands that has a population of about 127 million. Originally, individuals migrated from Korean peninsula in the late 400s and included the Chinese system of writing, the calendar, Confucianism, Buddhism, and East Asian beliefs about health and illness. Japanese traditional family values and practices are widely prevalent in various social aspects, such as providing care for the elderly. So, in most Japanese family households, they are multi generation. So, that would include the mom, the dad, their children, and the parents' parents. So, it has three generations. And then also, education is highly valued in Japan. The ratio of completion of the 12th grade is about 98%. And those of young people ensure a highly competent workforce. Japanese is the language of Japan, with the exception of the indigenous Ainu people. Politeness, personal responsibility, loyalty, and people working collectively for the greater good of the group are very important in the Japanese culture. An awareness of Japanese history and legend, a high regard for older people, the value of family honor, and veneration of dead ancestors suggest a strong connection with the past. Punctuality is highly valued in the Japanese culture. It's very structured as well. In the home, family structures is predominantly nuclear. Also, the wives often determine the household budget, their husband's pocket money, investments, family insurance, and real estate decisions, and all matters related to child rearing. In Japan, death or serious illness and mental illness are usually not common subjects for discussion, and Buddhist and Shinto beliefs play a significant part in response to death and grieving. In Shinto, death is believed to be impure and one should not spend time dwelling on it. In Buddhism, it is believed that all human beings suffer. When a Japanese person is dying, the family should be notified of the impending death so they can be at the dying person's bedside. Traditionally, the eldest son is responsible for making all the decisions during this time, and also group decision making among the family may be preferred when healthcare professionals are treating patients of the Japanese background. Many Japanese believe in reincarnation as Buddhist belief, and they also accept the Shinto recognition of eternal life of the soul, which means purification in the earthly life. And that's all for the history.
Shinto, which is the indigenous religion, is the focus of joyful events such as marriage and birth. Many festivals, which are called matsuri, are marked by offerings, parades, and carnivals on shrine grounds. The Japanese culture believes in a mixture of many religions. Some believe in reincarnation, which is a Buddhist belief, and eternal life of the soul, which needs purification of the earthly life, which is recognized by Shinto. They also believe that their ancestors can be called back to earth. They also believe of honoring one's family, country, working hard, and being a good group member, and joining one's deceased ancestors. They believe in the souls of the dead ancestors and gods, which they call kami.
Two of the traditional perceptions of health and illness among the Japanese. So the first one is with childbearing. So women are not supposed to express any pain because it's considered a virtue and a matter of family honor. Another one is that many Japanese hide the knowledge of deformity or disability in their family due to shame, and there are still instances of people with physical handicaps. The major and most common one is cerebral palsy among Japanese, are being admitted to psychiatric hospitals because they just don't have anywhere else for them to go and they really don't know what to do. So most children who grow up handicapped go to a special school rather than a public school, and many areas in Japan are not designed to cope with people who have disabilities, so they don't have ramps, they don't have, special parking, so they kind of lack all of those things. Two of the traditional healing methods among the Japanese, there's one called the Morta therapy, and it's one of the most popular indigenous models of psychotherapy in Japan, and it's used for excessive sensitivity to the social and natural environment. So it focuses on constructive physical activities that help patients adjust to and accept the reality in their lives. And it's different from Western psychotherapy in that it tries to avoid introspection and deep analysis of self and individualistic sense. The other most common one is Nikan therapy. It's also another indigenous psychotherapy of reflection on how much goodness and love is received from others, and is very much focused on well-being. So the Japanese culture interacts with healthcare providers by looking at physicians as highly esteemed or highly knowledgeable. There's no self-care evident in Japan, so being told what to do by the physicians is expected, and his or her authority is not questioned. The potential population-based health and healthcare disparities. So Japanese people tend to believe that they are psychologically different than non-Japanese people, and they may be a little skeptical of any recommendations by anybody who is not Japanese because they feel like they just don't understand them. So they may be less inclined to seek correction of minor orthopedic and dental variations, because to them they look at function rather than appearance.
Alrighty, so now to talk about interventions. So oftentimes with people from the Japanese culture are often stoic when having pain. So some interventions that you can do is, of course, you want to be able to assess for it. Oftentimes they may not tell you that they're having pain, but you can sometimes notice it. So you're going to assess for any grimacing. You're also going to assess the respirations. They can also increase when someone's in pain. Also, blood pressure can also increase when someone's in pain, and also heart rate. Then also, it's very important to educate. You want to be able to provide education about the pain and the pain medication and the benefits for taking that prescribed medication. And then for deformities, interventions would include, since a lot of deformities and other abnormalities can be genetically inherited, genetic counseling should be encouraged. Also, with that being said, parents can be educated about potential conditions that their child may be at risk for. Also, during pregnancy, it should be recommended to have an amniocentesis. This procedure normally is able to detect any abnormal conditions of the unborn child. And that's all for the interventions. Okay, now to talk about the specific goals. So for pain, the goal would be that the patient will verbalize decreased level of pain to a tolerable level of the client after 30 minutes of pharmacological and non-pharmacological interventions. So yes, it's very important that we have these goals made out to see that, to be able to later evaluate and see if our interventions worked. Another goal would be for the birth abnormalities is client will verbalize understanding of potential genetic risks. So oftentimes once you are able to educate about the genetic counseling and things like that, the patient will have more understanding of what's going on and understanding of what the potential risks that their unborn child may have. And that way they have more reassurance and they feel more at ease. And that's all I have for goals.